Hello, everyone, and thank you for joining us for our session today, Calling for Change, Reports from the National Convening on HIV and Employment, presented by the National Working Positive Coalition, or NWPC, with the members of the Leadership Planning Team from the Convening. My name is Mark Misrock. My pronouns are he and they, and I'm the Executive Director of the National Working Positive Coalition and a member of the U.S. People Living with HIV Caucus Steering Committee. We're excited in this workshop to be releasing recommendations from the National Convening on HIV and Employment, followed by a discussion with you and the Leadership Planning Team of strategies to strengthen responses to the employment needs of people living with or at greater vulnerability to HIV, with a focus on self-determination, well-informed decision-making, improved quality of life and well-being, and elimination of poverty and all other related inequities in all communities and all parts of the country. With our deep thanks for their partnership and support to ViiV Healthcare, the U.S. People Living with HIV Caucus, and Penn State University's College of Education, I now turn it over to Liza Conyers.
Hello, my name is Liza Conyers, and I use she, her pronouns. I'm the president of the National Working Positive Coalition Board of Directors. I also do research related to HIV and employment as a professor at Penn State University. The National Working Positive Coalition, better known as NWPC, was founded in 2003. Our mission is to facilitate systems change so people living with or at greater vulnerability to HIV can consider, access, or maintain employment based upon self-determined goals. This past April, we hosted a national convening on HIV and employment that was designed by guidance of our leadership planning team, who are all with us here today. The main goal of the convening was to bring community advocates, service providers, researchers, policy experts, state and federal government officials, and people living with or at greater vulnerability to HIV together to develop recommendations to strengthen responses to meet the employment needs of those who experience the greatest levels of economic and health inequities. Today, our leadership team is pleased to share the recommendations from the convening with you and to engage in a discussion about moving forward to implement and expand employment opportunities.
Thank you, Liza. My name is Vanessa Johnson. My pronouns are she, her, and hers. I serve as the Vice President for the National Working Positive Coalition, and I am a member of the 2021 National Convening on HIV and Employment Leadership Planning Team. I will be addressing unmet unemployment needs of people living with HIV or at greater vulnerability to HIV. Community input, as well as the federal government's 2021 HIV National Strategic Plan, Ending the HIV Epidemic Initiative, and the two previous National HIV/AIDS Strategic Plans all identify employment as a key social determinant of health and underscores the need to strengthen responses to employment needs of people living with or at greater vulnerability to HIV. Unfortunately, efforts to address these needs remain underdeveloped. For instance, few HIV care or prevention initiatives identify and address employment needs. Also, service providers need education and technical assistance to integrate responses to employment needs in HIV care and prevention initiatives. And finally, cross-sector coordination and collaboration is needed across government and community-based health, workforce development, education, housing, legal, and other service systems. Now, members of the leadership planning team will present the recommendations from the 2021 National Convening on HIV and Employment.
Hello, my name is Ronald Johnson, and I use he, him, his pronouns. I serve as the chair of the steering committee of the U.S. People Living with HIV Caucus, and I was a member of the Leadership Planning Team for the National Convening. The first service delivery recommendation that we want to present is focused on the need to expand access to community-located employment services for people living with or at greater vulnerability to HIV. Specifically, our recommendation is to establish flexible government and private funding initiatives to support implementing and sustaining community-located HIV-focused employment services programs. Community-located services are important because they enable people living with or at greater vulnerability to HIV to access employment-related information, services, and resources where they live. When possible, these services should be guided, staffed, and delivered by people living with or at greater vulnerability to HIV to ensure that these programs are responsive to the community in need of the services.
Hello, my name is Daphina Ward, pronoun she, her, hers, and I have the honor of serving as Executive Director of the Southern AIDS Coalition. And I'm here to share with you service recommendation number 2, establish and support local, state, regional, and national HIV employment network initiatives. Provide resources and technical assistance to local, state, regional, and national network initiatives to address employment needs of people living with or at greater vulnerability for HIV. The rationale that HIV-focused employment initiatives require coordination and partnership among multiple service systems informed by local, regional, and cultural contexts, and that this allows for the engagement of the diverse representation of stakeholders needed for effective responses to employment needs.
Once again, my name is Vanessa Johnson. Service recommendation number 3 calls for the development of an online repository of HIV-responsive employment-related information and resources to support individuals, service providers, policy advocates, and policymakers. There are 3 prongs to this recommendation. First, resources for individuals will support individuals considering employment needs, goals, and strategies, as well as provide links to local employment-related services and resources. Additionally, this resource will allow individuals to access information on working and access to financial, housing, and health coverage benefits and links to benefits advisement resources. Finally, individuals will be able to access information on legal rights and protections and related legal services. The second prong of this recommendation involves resources for service providers that will include support for providing relevant employment-related information and linkages to services and resources, as well as information on effective employment service delivery, models, and practices. And finally, the third prong, the repository will contain resources for policy advocates and policymakers, which will include information on key policy issues, developments, and opportunities related to strengthening responses to the employment needs of people living with or at greater vulnerability to HIV. Thank you.
My name is Tori Cooper. My pronouns are she, her, and hers, and by day, I am Director of Community Engagement at the Human Rights Campaign. By night and on weekends, I'm a kick-ass health and equity consultant and advocate for marginalized communities, especially Black people, people living with HIV, and the transgender community. I'm also one of the newest members of PACHA, the President's Advisory Council on HIV/AIDS. Recommendations developed by and for people living with HIV is one of the best ways to increase the capacity of people living with HIV to attain and retain gainful employment, which can lead to better health outcomes. I'm presenting policy recommendation number 1, establish an HIV and employment policy work group. The recommendation is to establish a multidisciplinary task force on HIV and employment with the charge of developing a plan to explain, expand, and improve employment opportunities for people living with or at greater vulnerability to HIV. Also, to ensure the work group includes diverse representation of people living with or at greater vulnerability to HIV, key federal agencies, including the Department of Labor, Department of Education, Department of Health and Human Services, HUD, and the Social Security Administration, as well as employment service providers, researchers, employers, and community advocates. This group's policy work will include a systemic review of key relevant laws, regulations, and administrative policies, and advocating for and monitoring implementation of employment-related provisions in the National HIV/AIDS Strategy and ending the HIV epidemic plans. Thank you.
I'm Reverend Nicholas Love, pronouns he, him. I'm a proud queer trans man with disabilities. I'm also a national subject matter expert on Social Security work incentives and employment for people who have disabilities. I'm presenting on policy recommendation number 2, collaborate with disability and chronic health condition advocates. The recommendation is to engage experts in disability and chronic health conditions to foster understanding and facilitate engagement with a broader community of disability and chronic health condition advocates, strengthen alliance and coalitions for collaboration on employment-related issues that impact all people with disabilities and or chronic health conditions, and share their knowledge, including best service delivery models and practices. Connection with a broader community will create collaboration on issues that impact all people with chronic health conditions and or disabilities. Sharing best practices regarding disability, healthcare coverage, housing programs, work incentive policies, employment services, and benefit information will strengthen services and expand information and resource reach. The shared knowledge will address intersectionality and break down silos. We can do better together.
Hey everyone, my name is Alfonso Mills and I use she, he, him, her pronouns. And I am a community health worker at Positive Impact Health Centers in Atlanta, Georgia, as well as the founder of Soul Model LLC, a business that uses virtual storytelling to empower communities. And I am here to present on our 3rd policy recommendation, disseminate the findings and recommendations from the 2021 convening on HIV and employment. And we want to recommend to develop and support implementation of a dissemination strategy of the convening findings and recommendations to respond to the urgency of the needs and to allow for greater community input into implementation of the recommendations moving forward, as well as host additional meetings with the convening participants and others to report back on the dissemination and implementation of the convening recommendations, effective practices, emerging research, and policy developments, and to obtain new and revised recommendations. We all know that nothing built for us should be built without us. So it is important that community is involved in every part of the process. So we want to make sure that whatever we learn from this convening, that information is given back to the community so that the people that are most impacted by these changes know what they are.
Hi, I'm Dylan Orr, member of the Advisory Committee for the National Convening on HIV and Employment and former Department of Labor representative for the National HIV/AIDS Strategy. Recommendation number 4, build and support systemic capacity to address employment needs of people living with or at greater vulnerability to HIV. This includes integrating training across delivery sectors, including implementing training across HHS, the U.S. Department of Labor, the Department of Education, HUD, including HAPWA, and the Social Security Administration. Update the HUD and DOL collaborative project, Getting to Work, an online training curriculum for service providers and housing providers, and the Office of Disability Employment Policy suite of HIV and employment resources at the U.S. Department of Labor. Coordinate federal agency resources among DOL, Department of Education, HHS, and HUD to provide employment services with supportive services of HHS's Ryan White HIV/AIDS program and the CDC Division of HIV Prevention. Collaborate with the Social Security Administration to establish pathways ensuring access to employment services and information about HIV care and supportive services for applicants living with HIV who are denied disability benefits. And finally, provide funding for state-level grants to support employment services and network initiatives. Thank you very much.
Hello, everyone. I'm Cody Lopez. I use he, him, his pronouns, and I'm the founder and CEO of BALR.Life, Black Advocates Leading Revolutions. Today, I will be presenting research recommendation number 1, evaluating the impacts of vocational development, employment services, and employment status. This recommendation is to implement and evaluate HIV-focused employment services by designing them for outcomes focused on quality of life, health, racial, ethnic, gender, economic empowerment, and HIV care and prevention, while also ensuring accessibility and responsiveness for services to those with the greatest employment needs. In addition, we want to prioritize implementation strategies for replication in jurisdictions most impacted by HIV and other health and economic disparities by building on existing effective employment initiatives and providing technical assistance and support for new employment service providers.
Hello, everyone. My name is Luis Scagabarozzi. I'm the Vice President of the Latino Commission on AIDS. And following up with the presentation, I am going to talk about number 2, identify employment-related needs and services at local and state levels. So how important it is to implement statewide or local employment needs assessments to identify employment needs and barriers for people living with or at greater vulnerability for HIV. Utilize employment needs assessments of people living with HIV or greater vulnerability to HIV to inform the development of responsive training and service delivery and policy. And then conduct network analysis to examine the impact of cross-sector service network coordination among public health, workforce development, education, legal, and housing service providers on HIV care and prevention outcomes.
This is Liza Conyers, and I'm presenting research recommendation number 3. Develop a considering work and well-being framework for HIV care and prevention. This recommendation focuses on the need to support development of a considering work and well-being service delivery and program evaluation framework that reflects recommendations, values, and priorities articulated by community advocates. The rationale for this recommendation stresses the importance of providing a consistent approach to evaluating employment services that incorporates community engagement, quality of life, and well-being as prioritized outcomes, along with HIV health and prevention. Above all, the model needs to be client-centered and based on self-determined goals.
So very exciting to hear these recommendations presented. My deepest thanks to all of the members of the Leadership Planning Team for the 2021 National Convening on HIV and Employment. Let me share a bit with you moving forward about some developments advancing the work of the convening. The National Working Positive Coalition was asked by ONAP, the Office of National AIDS Policy, to provide recommendations for federal agencies to strengthen responses to employment needs for updating the National HIV/AIDS Strategy. State-level HIV employment network initiatives have been accomplishing inspiring work in Pennsylvania, in Illinois, and in New York. The U.S. People Living with HIV Caucus released Demanding Better, an HIV federal policy agenda by people living with HIV, including addressing employment needs of people living with HIV as a priority. And the National Working Positive Coalition is now working to develop meetings and other avenues for engaging stakeholders in discussion of the convening recommendations and ideas for additional strategies to address employment needs of people living with or at greater vulnerability to HIV in the US. We are grateful to our partners and supporters, including ViiV Healthcare, the US People Living with HIV Caucus, Penn State University's College of Education, all of the magnificent members of the Leadership Planning Team, and the many other individuals who contributed powerfully to the convening to advance this work. We now will all join you live for a discussion of your questions and thoughts about these recommendations presented today. Other recommendations you'd encourage being included in the future, and any comments or ideas you have for sharpening and advancing the work to increase and improve employment opportunities and address needs for employment-related information, services, and resources for people living with HIV and for communities at greater vulnerability to HIV moving forward. Thank you all for joining us today. I look forward to further discussion, including you now.